Hi everyone, this is Dr. Vinod Revankar from VR Revankar Hospital, Avlali, Bangalore. Yeah, I am presenting a very interesting unique case what we had recently, a procedure being done. Yeah, this is regarding a gentleman who was 58 years old, presented with history of stroke. Basically 80% of the strokes are because of ischemia. What we mean by that is it's an impaired flow of blood because of narrowing down of the blood vessels. Out of 80%, 20 to 25% patients have posterior circulation stroke. So we have something called as an anterior circulation stroke and posterior circulation stroke. Anterior circulation stroke, you have options of medical treatment, then you have surgical intervention like surgical endarterectomy, and third option is an angioplasty, when we put a stent and improve the circulation of flow fluid. But posterior circulation stroke, you have very limited offer. Either it is medical line of treatment, surgery is not preferred because technicality there's a lot of issue, mortality is very high and outcomes are bad. So we have especially in the posterior circulation stroke, if somebody ends up in a stroke, the mortality is almost around 80 to 100%. A person who is symptomatic and documented a block within the vertebral artery, they have a recurrence of an stroke almost to the tune of around 40 to 50%. And as I told you, mortality is almost 80-100%. So angioplasty as an intervention has been a new modality of treatment with success rate of almost around 96 to 97%, risk complications being around 2 to 6%. And minor stroke and probably restenosis reblock within that has been a very small, to the tune of 2 to 4% as conventional to medical line of treatment. So this person had a stroke. He had features of posterior circulation stroke in terms of speech being slurred, what we call as dysarthria. Then he had truncal ataxia, inability to sit, walk. Then he had swaying when he would walk. So these are classical features. Yeah, when somebody goes in an extreme form of stroke, they will have unconsciousness, deep coma, and probably mortality of 800. So this patient went through an MRI angiogram. He had blocks in both the vertebral arteries, the blocks being to the tune of 80 to 90%. And vertebral basilar artery being perfused, very underperfused. So he was having recurrent TIs. We took him for a procedure angioplasty at our center. We managed to, he had a block, critical block in V4 segment of the vertebral artery. When we stented him, went home very clean without absolutely no neurological deficit, no stroke, and was discharged immediately the second day post procedure. So this form of modality of treatment we do give it at our hospital with a very minimal risk and assuring of a significant good outcome and life for a patient on a long term as well as short term also. Thank you. Thanks a lot.